Well, thank you very much, and I'd like to bring up our esteemed Health Commissioner Bevan Baker, who needs to be ready to punt this weekend, so you need to. So, Commissioner.
Thank you. Thank you. Thank you all for being here, and thank you, Mayor Barrett, for your leadership, and thank you, Alderman Wade, for your continued leadership and support here in the 7th District. Thanks to all our invited guests. Certainly, it was a pleasure to talk with the 7th District Police Captain Howard earlier, and community liaison officers who are here, Northwestern Mutual, and representatives of B. Harris. You know, it's a community support that's allowed this this center to be here for 80 years and to thrive, and to have our great employees and all of those who come here to serve our citizens. When you look at this building, it's a testament to why this center was founded, and the legacy is clear today. It's a partnership between the city's leadership and the community to better the health of our entire community. And none of us would be standing here today talking about this if it wasn't for the foresight of Matthew and Antoinette Keenan. This person was dedicated to the city. You've heard about his service. You've heard about that. But it's his spirit, the embodiment of his spirit, that agape nature of wanting to make his community better. And that is at the core of public health. He played a great role in business, and that's clear. Keenan supports business by making our community healthy. And that legacy is going on and on. So we had to be broad-minded when we think about the Keenan Health Center and its legacy. It's a public-spirited intervention that someone thought about some 80 years ago. And the fact that that placard there talks about race, color, and religions not being barriers to someone getting help. Again, that's a cornerstone of public health. We treat, we serve, and we look to treat anyone who comes into our city in need of help. So decades and decades have passed since this center began serving this community, and you look back into the 1940s when Milwaukee was once the healthiest city, and this was the cornerstone of it winning that healthiest city competition over and over again. And we know that it was probably stopped because we were running up the score, just like you can do in football sometimes. Undoubtedly, this center played a major role in that, and I think that the health department has been at the center of this community being healthy. It's a place where children can get their vaccine. There's nothing more important, and Mayor Barrett talked about how we've enhanced that rate, but it was needed then and it's needed now. And those long lines that existed in the 1930s and 40s, fast forward to our H1N1 outbreak a few years ago, we saw the same long lines, and it's here. One of the other things I thought about recently, and as we went through the election season, Keenan is a polling site. I remember coming in one day for meetings and seeing the line outside the door, people voting, but also a line going in for people getting service. That is the intersection of both health and the fact that we have our legislative process. So citizens are being able to vote here, get their services here. It's a place where cancers are diagnosed. It's a place where people come when they're down and out, but it all happens here. 15,000 times a year, clinic visits happens here, and we deal with those issues that the mayor talked about, infant mortality and STDs, HIV, tuberculosis. These are some difficult issues to tackle. As I walked around this morning, I was able to look at some of the archived photos, and it was somewhat heart-wrenching to think about what the challenges may have been and what the issues were when they were trying to make health care accessible to everyone, to make certain that it didn't matter if you had money or didn't have money. Fast forward to this day and time, we're having those same discussions as we try to expand the Affordable Care Act. Things haven't changed. Keenan has weathered the storm through all of these things. So it takes an incredible commitment from city leaders, community partners, and everyone to make certain that this happens. When we look at the past, when we look at the future of Keenan, we know that it will remain the cornerstone, it will remain the place that there's an intersection between citizens, commerce, business, city, and health. And these are the things that makes it go around. I was really struck by the photo of former Mayor Hone and Health Commissioner Kohler back in 1932 at the groundbreaking. And Commissioner Hernandez and I were talking earlier about what must have been going through their minds, and the fact that they were making this move. And the same types of things are happening here every day. Now, there's one thing that you don't necessarily see at that groundbreaking, but I think I see it here, and that is the incredible commitment of public servants, civil servants, and employees. And at a time where there's some who would like to berate city employees, governmental employees, that has never been the case and never been more important to applaud the work of our past employees and current employees here at Keenan. It's a true reminder that Keenan wouldn't be here. Yes, the bricks and mortar could be here 80 years later, but it's been 80 years of tremendous civil service by employees who have been here. And we should take a brief moment to not only recognize all of those employees, but to thank them immensely. And it's great to see some of you come back to this old building with new and exciting ideas about how we can move forward. A big thanks goes to our Commissioner of DPW and their staff who were instrumental in this remodeling. I remember when I first came to this city some 12 years ago, this is one of the first buildings that I rounded in, and I saw this incredible architecture and couldn't imagine what it must have cost to construct this building with terrazzo and marble and inlays. It was just a beautiful place to come. And to bring it back to its original luster and to have it looking great this morning, it tells every citizen who comes in that we care about them. It's a better way to serve our community, and it's a beacon for how people should look at Keenan. So it's a celebration today, and I think I'm honored. And when I look back, and somewhat of a historian, and I look through the archives and the memoirs of the previous 15 health commissioners, one thing that we had in common and one thing that we still will always be bonded by was the link to citizens, to take everything that we got and open the doors of our facilities to make certain that we could do that. So when I read the memoirs of all the previous health commissioners, they said the same thing. We want to open our doors. We want to make certain that everyone can get served. And that's what we've done here today. That's what Keenan has done for some 80 years, open its doors and make certain that everyone could get service. I certainly want to give a special thank you to those employees who work at this site. I mean, I think that working in a place where people come when they have nowhere else to turn, particularly with sexually transmitted disease, it's a tough thing. And I went in the men's room earlier, and there was a little sign there that's been there probably for 40 years, and it says, "Don't just stand there, do something." You know, and they're talking about sexually transmitted disease, and I just think about it's these little nuggets, these little quirks in terms of how Keenan has communicated, how it makes it comfortable, how you can come here anonymously and get the services that you need, and know that there's going to be great staff here who care about you, who care about public health. This is the cornerstone of our lives, and it's a cornerstone of what we do. So I'm truly honored and humbled to stand with you today, and it's been great to see all of our employees come back, and thank you. And thanks to Yvette Rowe, because I know in terms of this remodel, I mean, and this anniversary, some 5-6 years ago, we started talking about this day. So, Yvette, thank you. And I want to invite Mayor Barrett back to the podium now. Thank you, Mayor.
Thank you, Governor.